Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soulé.
And welcome to Community Conversations. I am here today with 2 people that I have never had on. I say that more and more because I'm reaching out to more and more people. But one of the things that is a constant refrain, no matter where I go, is a conversation about COVID. It used to be about COVID testing. Now it's about COVID vaccinations. So you'll be happy to know that the 2 people that I brought in today have been part of our expanded staff, that is a volunteer group that has helped us. You've seen so many people at our events and talk to them on the telephone as well. So I'm very, very happy to have them here today. Pat Brier, who is a volunteer, as well as the chairperson of the Johns Island Foundation. Thank you. I wanted to say Community Service League, but that was 2 years ago. So now she's with the foundation, and we're ever so grateful for the efforts of the Johns Island groups as well. And Judi Miller, who is a board member and has stepped forward, probably a little naively, to say, sure, I'll help you with the volunteers.
I've loved every minute of it, Vicki.
I know you have. But the group expanded far beyond our initial thoughts, didn't they?
Oh, it certainly did. When you called me and asked me if I would coordinate volunteers, we had, maybe 6. Mm-hmm. And all of a sudden, we had 20, and then we had 40, and then we had 60, and we set up a waiting list at 75.
Yes, we did.
So, yes.
Because just like everything else, you don't expect what actually happens oftentimes. And then when you do, it's like, oh, I'm behind the 8 ball. Okay, well, sure, we'll take more. And so Pat was, I think, sort of in the middle group there. Not the very first, but certainly at the beginning.
Yeah, I came on probably right after the first initial group came in.
Yeah. So how did you find out about us in terms of volunteers? Because we hadn't had a volunteer program for many years.
I think I just kind of mentioned to somebody, I don't know if it was you or to somebody at TCCH or maybe even to Judi, that if you guys needed any help, I'd be happy to help in any way that I could.
Oh, those were the magic words.
I'm sure that they were. And lo and behold, I got a phone call.
That's right, because we went from 0 to 60 miles an hour within about a week's time. We had our first event at the fairgrounds on January 2nd, and we had 500 people there for the first vaccine mass event. And so we held our first orientation for volunteers the following Wednesday. Within 4 days, we knew we need help. Those were the magic words. So what has your experience been like, Pat?
Oh, my experience has been absolutely wonderful and remarkable. It's the highlight of my day. I was telling Judi on Monday mornings when I go to do some phone calls, which I really enjoy, being able to tell people that they're able to get their vaccine, it just brightens their morning, their week, their year. And for me, just hearing how happy they are makes me feel like I'm doing something worthwhile with my time. And I've also done the events. And the events, I get to work alongside some of the nicest people at TCCH.
We feel the same.
Well, thanks. But we do work alongside each other. That was the one thing that I really wanted to comment on, is that they never have made us feel like we work for TCCH. They make us feel like we're part of the family. And they've, taken care of us to make sure that, if we need anything, any water, they've even brought us lunch at times when we've worked longer. It's just been really nice. And the process has been so smooth. And again, at these events, the people who are getting their shots are just so grateful that even some of the people coming through have given us water. Some have brought us cookies and chocolate. And it's been amazing. And they'll say, thank you, every time that comes through. I mean, you hear that all the time. It's been a very good, worthwhile experience. And I think everybody should do it. It's humbling. It's just a great way to get to know the community.
Volunteerism in general.
Absolutely.
Yeah. No,
we create a community by volunteering. There's no doubt about it.
I would agree. Judi, We already said it wasn't what you expected. but tell us about your thoughts at this point.
Well, I'd been a board member for TCCH for almost 5 years.
Mm-hmm.
And this experience, more than anything else, I think, has made me even more aware of the wonderful mission and the incredible way patients are treated at TCCH. I could never have known that without this this work that I've done.
It's not enough to read on paper, is it?
It isn't. It's wonderful being a board member, and I've enjoyed almost every minute of that. But this is just different. Hearing what the patients who come through the lines say, hearing what the volunteers say, I get more calls than I can even begin to tell you from volunteers who are so grateful for the experience. And, it's just, it's the kind of the philosophy of, you can do something in life as one person, but you're only one person. You can't do everything, but you can do something. And all of our volunteers really believe in that philosophy. They want to be able to do something to make a difference. And yet you never know by the way they just step in there and they do whatever needs to be done, that, they're all so humble and so grateful about it. It's wonderful just being associated with people like this.
And just to clarify, not all of our volunteers certainly have come from the Johns Island community.
Oh, we've got people from all over this community, which 75 people from all over this community. And it's just tremendous the way they've stepped forward. Vicki, it's about time to do timesheets again for this this coming time period. We do them every 2 weeks. And just to give you a little perspective on how much work is being contributed, as of the 31st of March, it was 2,909 hours that volunteers had contributed. And I was looking at this independent sector research. They value volunteer time at $27.20 an hour. Well, that's $79,000 and change for just a period from January 18th through now.
And to say we're grateful doesn't begin to express it.
How do you say you're grateful for it? It's just
because what people don't realize, perhaps, is that this is not a money-making endeavor, okay? The vaccines come free from the federal government or from the local county, which gets them from higher up. And we are allowed to charge for the administration of it. But the reality is, as many people who are in private practice will tell you, it's not worth the billing exercise, okay? The admin fee has been raised in an effort to get more people, more providers, more physicians and dentists and community members that can to give out the vaccine. But the reality is it's an effort from the heart rather than because of the pocketbook. And so because of that, it's not like we could go out and hire a bunch of temps, okay? Nor, to be perfectly honest, do we want to, because we work real hard at having that caring culture. And so I appreciate those words. We get a lot of thank you cards. We have gotten some donations. We also get some questions, not to lessen, I'd like to have like rockets going off when I say those things, because it really does make us feel so good. But I also get comments like, it wasn't at all like I saw on television. And we didn't have to stay overnight. And, calling in, they gave us an appointment the very next day. Those are our rewards rather than the financial. Oh. She says to the lady who is in charge of grants at JI. I'm sorry. I know those are mixed messages. We really try to be long-term sustainable, but it has to be at the right time, place, and for the right reasons in terms of what we charge and who we charge it of. We don't turn anyone away, so this really helps our mission in terms of taking care of everyone in the community, rich or poor, old or young, whoever needs us. That's our mission, okay? And so you guys have really helped us in that regard. So before I get on a soapbox, I'm going to call for a station break, and then we'll come back and we'll talk about other aspects of volunteering, okay?
Okay, sounds great.
Great. Hi, I'm Vicki Soulé, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not, and at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
Hello, residents of Indian River County. The Solid Waste Disposal District invites you to join us for our residential paper shredding event this Saturday from 9 a.m. to 2 p.m. Find us at Southeast Secure Shredding, 3910 US 1. Recycle right and bring up to 3 boxes of paper to be shredded and recycled at no cost to you. Limited to the first 800 cars.
Visit us at ircrecycles.com. Indian River County. Roll with us, recycle.
Are you becoming a realtor, contractor, mold remediator, guardian? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
And welcome back to Community Conversations. This is Vicki Soulé from Treasure Coast Community Health, where we do primary medical, dental, behavioral health. We have low-cost pharmacies, and most especially, we care for you as we would members of our own family. That is our mantra. Healthcare for all. We don't turn anyone away. We try to make arrangements, everything from a sliding fee scale discount to payment plans to working with the insurance companies, because we do take all insurances as well. And so today I have with me 2 of our volunteers. It's such an honor to say that because since Barbara Carlin retired some years back, we have not had an active volunteer program. But as I said earlier in the program, if seeing 500 people come through a line on January 2nd wasn't convincing that we were going to need help, there was nothing that could have. Everyone that came that day was wonderful. We had a great day and got a lot of compliments, and then turned the site over to the health department, who said, "You make it look easy. We can do that." And they have, which has been wonderful. And we have continued giving out vaccines at mass vaccination events. We call them drive-throughs because you stay in your car. And we have been to the Gifford Health Center. We've been to the Intergenerational Center, courtesy of the county, which has also loaned us their parking lot across the street from the Gifford Health Center as needed, so that we don't back up traffic onto 28th Court. And then, of course, it would be remiss of me not to include Fellsmere, where Operation Hope's leadership has let us use that facility right across, well, kitty corner across the road from our old Fellsmere location, which I have to stop saying old, because while it is the most senior, it's also the latest one that has been revitalized both inside and out, and it's a wonderful place. So if you haven't had an opportunity to see any of our facilities, I would invite you to do so. Maybe not in April, because we were just talking during the break. Now people are starting to venture out to their doctors, their dentists, their beauticians, all those places that were on the off list when it was safer at home months, many months. But now we're starting to come out again. And so we are finding that while many people anticipate going up north isn't a great place compared to Florida right now. So I'm not sure how many snowbirds will actually leave. The numbers are swelling still up north. But we are very grateful for the time that we have with all of our volunteers, whether they're snowbirds or not snowbirds. So, Judi, you were talking about as a board member, you really didn't feel you understood Treasure Coast Community Health as well from a paperwork and discussion point of view with our monthly board meetings as coming to working with the volunteers as a volunteer coordinator.
Well, you see a different side of it. Of course, I sit on the finance committee, so I see all the numbers, and numbers are something I definitely relate to after years of being a nonprofit CEO. But numbers are different than your work with people. And I've had just a firsthand way to observe the kind of caring service that is given both by the staff members and the volunteers and all of the administration, and the work that you've put into what's happened with this vaccination project is just phenomenal. And I would never have seen that had I not stepped forward and said, yes, I would help with the volunteer coordination.
With 70 plus volunteers.
And I'm so grateful. I feel so blessed. You know, 2020 has been kind of a struggle of a year for everybody, but between my family and my friends and the volunteer work I've done
our
with
new friends,
TCCH and Moonshot Community Action Network, I've kept sane and happy all this time.
No retirement regrets, eh?
Oh, everyone tells me I've failed retirement, and that's probably true.
It probably is. So in the future, I know that you've already received inquiries. You know, what will happen with the volunteer program? Yes. What will happen to the volunteers? Is there still a need?
So you and I have been talking, Vicki, because the volunteerism that people have, you know, the hours that they've offered, there's something that they give from the heart. And a lot of the folks who've been volunteering don't want that to stop after COVID is over. I've told them to keep my name and my phone number and my email address and to call me when they get back in town, because I've assured them Vicki is thinking of new and exciting ways for them to help.
Well, you're absolutely correct, and I'm not going to spill the beans on the air, but the reality is even in 2020, when we had so many people who were hesitant to stay home, hesitant to come in and rather felt they should stay home, we still saw about 50 people less than the year before. And the year before, we had over 25,000 individual people come through our doorways. And so I expect that this year we're going to see even more. We have hired additional staffing because it does take a while. So I rubbed the crystal ball real hard and said, well, if they're staying home, that doesn't mean that their diabetes went away or their teeth miraculously got better or that they stopped smoking or those other things. And based on faith, and when I say that, it's mostly faith in our staff, because they do almost to an individual treat them as if they're a family member when they come across the doorway. Now, some of our younger people haven't mastered yet the I'm so glad to see you at 18, 19, and 20.
But they will.
But they are. Because what I have seen over time is they look at the rest of their colleagues, and we all model behavior. And I do believe that is at every level, okay? My husband commented that I had gone in to work with the vaccine group over the weekend, and he said, I wonder how many CEOs do that. And I said, I think there's more than you realize. We just don't do it for the applause. We do it because we want our staff to know we're with them and we're not just ruling from a ivory tower or whatever those terms are now. And so I do want people to understand that if they don't get treated the way I'm describing, and it happens more than once, somebody within our system needs to know that. Everybody can come in with a bad hair day. We try to compartmentalize, but again, that gets easier as you get older, okay? Some of our newer people, this may be their first job experience, but I watch them look at our medical assistants, and you can almost hear their brains saying, I could call people out of the lobby and take their weight and their blood pressure. What do I have to learn in order to do that? Where do I go to school? And our medical associates look at our licensed practical nurses. And so when we have turnover, it's an up increase, okay? That's not to say we're not perfect or perfect. We're evolving, and we have been evolving over these last, well, I can account for a dozen years anyways. So thank you all for the business that you have given us. But when you talk about volunteers and where does that role happen, we are doing more communication with our patients, because again, when you think about that many numbers, you don't want to feel like a number, okay? You still want to have that personal connection, that trust. I mean, when I go to a new hairdresser, I kind of size her up within 5 minutes, and then the final verdict is what my hair looks like at the end, right? But I have gotten up out of chairs in those first 5 minutes as I have been in different communities and had a referral. And it's just like, oh no, this person's not listening to me. So we all do that. And I hope that everyone's experience at Treasure Coast Community Health is either good or you let us know where we're lacking. And I think the staff understand that that's the criteria by which we operate. Not a threat, it's just who we are. So when we talk about the volunteers, you guys have made a lot of phone calls as well as received a lot of phone calls. And I hope that we can continue that. I hope we're not standing in a field in August still giving out vaccinations when it's 92 degrees at 10 a.m.
Either.
Yeah, exactly. I do see that shifting back into our visits, just like the flu shots. We give flu clinics, but after a bit, it's like when you come in, you get your flu shot. When you come in, I anticipate that COVID will be in that same fashion. Now, am I predicting it'll be yearly? No, I don't know. Nobody really does, although they say the antibodies are doing pretty well. Do you think most of the volunteers would see that as a good opportunity, or is part of it getting together to make the calls?
I think that they do enjoy the camaraderie to a point, but I think that what people started to come back and why they volunteered was because this was something bigger than us. I think this was something that we all felt an obligation or a responsibility more so to help get this, the people healthy so that our lives can get back to being normal. And I think it was a very humbling experience for most of us to see some very elderly people, not that I'm not old, but older than me, not be able to get to out to get their shots.
We had a lot of people in their 90s.
Yeah, and
that we took care of initially.
Events where I've seen other community resources bring them in on buses to get their shots and to be part of that and to help actually fill out forms with them. I think that no matter what we've done, the going and volunteering with the TCCH has really taught us a lot also about how you operate as a agency or as a business in town and how you take care of your patients. And that has made us feel really good about working there as well. Like I said before, I've been doing this a little bit in both, areas of phoning and events. And again, everybody has just made all of us feel like we are part of a bigger family. And we've gotten to know other people in the community. As you said, I'm from Jones Island, but I have met some other people from other areas, and we've just enjoyed each other's company. We've gotten to know other people, and really that's what we're supposed to be about.
And that's what community is about.
Exactly.
And volunteering helps you get there.
It builds it, for sure.
Absolutely does.
So I think it will work.
All right.
I know
really good news.
I'll be willing to come back.
All right. I've got that in my mind, and I'm not going to forget that.
On that happy note, I want to thank you both for being here and telling us true from the heart what your experience has been like. And again, I would recommend that those of you that are in the listening audience think about the United Way. They have a whole plethora of volunteer opportunities, including Treasure Coast. So don't limit yourself. If you're not interested in healthcare, but you love the libraries, or you love being part of a more scientific or a different kind of business, think about volunteering. Go to their list, go on United Way of Indian River County, and you'll have a good time too. Thank you, and have a great evening.